Brookings Institution, and I do study Social Security, and so I'm aware of a lot of other literature. This is a valuable contribution to our knowledge about how much older people, and particularly different population groups amongst the aged, depend on Social Security. It's the most important income source for the great majority of the elderly. That's been true, I think, since the middle of the 1960s. Cutting it would have very serious repercussions on the most vulnerable amongst the aged. It's even more important for women than it is for men, and in research that this group has done, a lot of the difference is for women who are not currently married. Social Security is also disproportionately important for disadvantaged minorities, which Heidi just showed. Social Security grows more important as elderly Americans get older, and this is mainly because it's harder to earn wages when people get older, and so Social Security becomes a more important component of income as people get older. It's harder to earn money when you're 68 than when you're 63, and it's even harder still to earn when you're 78 instead of 68. This report clearly shows that earnings are much less common for the folks past 75 than they are for 65 to 74-year-olds, and they're more important, the earnings are more important for people between 62 and 64 than they are for people past 65. And the lesson of the pattern is very simple. Advancing age just makes it harder to earn wages, to support yourself. Notice, however, in this report that in the younger age groups, 62 to 64 and 65 to 74, a higher percentage of both women and of men had earnings in 2009 compared with 1999. And the wage earnings of these age groups have been increasing, and consequently labor earnings are a more important source of income. And this is consistent with labor economists' finding, including my own, that over the last 20 years, the last 10 years, people are staying in the workforce longer, and earnings are important in their income later in life. When looking at the numbers, bear in mind that the IWPR analysts have adjusted for inflation. This is not nominal dollars compared to nominal dollars. This is the real purchasing power of the wages and incomes that people have at 2 points in time. And furthermore, they're comparing a year with low unemployment, 1999, with a year with exceptionally high unemployment. The difference was in 99, the unemployment rate was 4.2%. In 2009, it was 9.6%. So the fact that earnings are more important, in spite of the fact that the labor market was in the toilet, is an impressive reflection of how much more employment is important to older people than it was even 10 years ago. The incomes of the aged, with the exception of asset income, have been pretty well protected against the severe income drops that most of the rest of the population has sustained in the Great Recession. And this is particularly striking compared with the incomes of people, let's say, of middle age and young people who depend much more on their labor income. Labor incomes have fallen very sharply in the Great Recession. It's still the case, as of the third quarter of this year, that total wage earnings are lower than they were at the end of 2007. So, and per person of working age, they're obviously down even more sharply. But of course, asset income is volatile too, and some aged families do depend on their asset income. But the important thing to bear in mind is this is a smaller portion of the incomes of the aged than earnings are for the non-aged. That's number one. And number two, the more vulnerable parts of the aged population, asset income is even less important than it is our earnings for the more vulnerable parts of the non-aged population. Social Security income has gone up since 1999, erasing the effects of lower asset incomes. The IWPR analyst shows that one exception to the pattern, the population between 62 to 64, Social Security benefits are down a little bit, and that's partly because Social Security early retirement benefits have slipped as the normal retirement age has gone up. But it's also because fewer people are claiming pensions at age 62 than did in the past. They're still working. And it's also because some of the more affluent elderly continue to work, and they now collect it and delay collecting a Social Security pension. Social Security is overwhelmingly important in reducing inequality and especially poverty, mainly because it boosts the income of those aged and disabled folks who would have very low incomes in the absence of this critical program. But let me close on a very positive note, I think. It's easy to be gloomy about the U.S. economy right now. And it's also true, as this IWPR study shows, that a bigger fraction of the older old, especially, are more dependent on Social Security than was the case back in 1999. But the poverty situation of elderly Americans has actually improved since 1999. In spite of the fact that the unemployment rate is now 9.5%, where it was below 4.5% back then, the 2009 poverty rate among the elderly was 8.9%. That compares with 9.7% back in 1999. The fraction of the aged with incomes below 1.5 times the poverty line has also fallen 2.4 percentage points, which is more than 10%. So for the great majority of the nation's aged population, including those who are at the bottom, in the bottom third of the old age income distribution, the social safety net is still getting the job done. The overwhelming majority of America's elderly have been spared from the worst side effects of the nation's worst post-war recession.
Thank you, Heidi, for inviting me to be part of this program. I'm, again, Virginia Reno, Vice President for Income Security at the National Academy of Social Insurance. And I want to congratulate IWPR for this excellent new report. It clearly shows the important role that Social Security fills for older Americans. And it documents, I think for the first time that I've seen it so clearly, the growing reliance on Social Security during the past decade. That growing reliance is largely because other sources of income have dwindled, not because Social Security has gotten substantially bigger. I'd like to step back and put this kind of in context. We have policy proposals, we've seen several, from the Deficit Commission and others that look out, that are trying to put Social Security in balance for the very long term, for 75 years and beyond. And the proposals focus largely on shrinking Social Security. This report helps show why shrinking Social Security may not be in the best interest of our older people or of the population generally. So I would like to focus more on thinking about ways to strengthen Social Security through revenues rather than through shrinkage. Why would we do that? This is a quick run through of possible reasons, and we'll talk about each one a little more. First, back in 1983, the last time there was major reforms to Social Security, the big part of the reform for long-term solvency was shrinking benefits. And an important piece of that was raising the age of eligibility for full retirement benefits. That change is still being phased in, so that benefits relative to prior earnings will be lower at each age they are claimed. That's beginning to take effect now, and it will continue for another 15 years. Second, with those cuts, Social Security is affordable, and we have some data to show that. Moreover, more of us will be depending on the program, so we can't expect it to shrink substantially and still serve the role. Finally, Americans value the program, and they say they're willing to pay for it, and we have many policy options to, in rather inobtrusive ways, find the revenues to pay for it out in the future. My work is drawing on really two recent NASI reports. One is a public opinion poll that looked at attitudes toward Social Security that I'll be citing. Another is an array of policy options for bringing it into long-term balance. On this question of the adequacy of benefits in the future, this chart illustrates so-called replacement rates, the level at which benefits replace prior earnings for an average earner. The blue bar is 2005, and at that time, benefits for this average earner replaced about 39% of prior lifetime earnings after deducting Medicare premiums, which come directly out of benefit checks. By 2010, that replacement rate has fallen to 37%, largely because we're phasing in a higher retirement age, which is that across-the-board benefit cut. By 2030, when all of the retirement age changes are phased in, that replacement rate is scheduled to be 32%, after Medicare premiums. And this is the result of two changes. First, the increase in the full benefit age, but secondly, ever-rising Medicare premiums coming directly out of benefit checks. Next slide. With these cuts, I think it's hard to argue that Social Security is anything other than affordable. This chart shows the cost of currently legislated benefits as a share of the entire economy or gross domestic product. It's almost a flat line, not completely a flat line. It rises from about 5% now to about 6% when all boomers are retired, and stays about 6% for the rest of this projection period. Now, these benefits are not fully financed with the legislated revenues, but this is the cost. Now, it's important to put this in context. We often hear that Social Security, Medicare, and Medicaid are unaffordable. That's the health programs that are rising inexorably in cost out into the future. Social Security is not. As Dean Baker once quipped, if you said Medicare, Medicaid, and dog catching are unaffordable, it's not that dog catching is unaffordable. It's the health programs. Next. The other part of our research asked American people their views about Social Security. This tabulates our finding from the opinion poll on the question, I don't mind paying Social Security taxes because it provides security and stability to millions of other Americans, the disabled and children and widowed spouses of deceased workers. This is an agree-disagree kind of question. The vast majority of Americans gave a positive agreement to that. That's true for the total at 87%, was true of 93% of Democrats, 85% of independents, 81% of Republicans. This was a survey done in the summer of 2009, but these findings are consistent with what prior surveys and more recent surveys have also shown. Secondly, across age groups, when we ask the question, again, agree-disagree question. It's critical that we preserve Social Security for future generations, even if it means increasing working Americans' contributions to Social Security taxes. In this case, again, we get overwhelming agreement among the working age population, which are the most relevant ones to ask. 79% of the younger group, 71% of the middle group, and 76% of those 50 to 64 years old. So clearly we have agreement on willingness to pay for Social Security. I think the point we're suggesting is there are many options for actually raising revenues to do the job, but to date, revenue increases have kind of gotten short shrift in the discussion about how to fix it. So we hope